The patient will have an expected amount of pain after surgery. First 2 weeks are usually the worst. Having said that, there are medications that are given, both narcotic and non-narcotic, to make sure this pain is addressed appropriately. We give local anesthetic before the procedure that tends to be more long-acting than a typical local anesthetic. Most of the time, the pain after surgery is well managed with oral medications. Occasionally, for some people, this isn't enough. If this is the case, then we can always manage the pain in the appropriate manner afterwards. Immediately after surgery, there will be a compression device around the incision site, the scrotum, and the penis. This is important to help reduce swelling. The day after, this compression device will be taken off, but there will be a scrotal support given to help to reduce swelling after surgery. It's important also to apply ice 1 hour on, 1 hour off, approximately 3 times a day to help to reduce that swelling. It's also important to keep the scrotal support on for as long as possible during the day. It's not necessary to keep it on for 24 hours, but it is important to keep it on for as long as possible during the day. These steps can be useful to help to prevent swelling after surgery. You'll be given very specific instructions on how to take care of the incision site after surgery. It's important that you follow these instructions very carefully, and if there are any questions, please ask the office as we will go over these instructions with you. It is important to remember that the surgery site itself may open up after surgery. There may be some reddish material, or there may be some dry yellowish material that accumulates on the incision site itself. All of these things are normal and expected. However, if there's any kind of purulence, if there's any kind of foul-smelling material, or if there's any kind of drainage from the incision site, you need to notify the surgeon immediately. These aren't necessarily, but could be the signs of an infection, and if that's the case, then there may be a need for immediate surgical intervention to help to prevent that infection from getting worse. The placement of the pump after penile surgery is an important part of the surgery itself because that's the access that the patient has to inflate and deflate the prosthesis. So it's important for that access to be easy to identify and reach for the patient. Having said that, one of the things that can happen after surgery is there can develop scar tissue that can then put the prosthesis pump in a place that isn't desired. You can actually move the prosthesis pump in a place that was initially placed to another place that's harder to reach. As such, one of the things that we recommend is to pull down the pump into the most posterior or the lowest part of the scrotum as possible. That process should occur at approximately 2 weeks. At that point, it may be useful to pull the pump down every day to make sure that it stays in the correct position so as to allow for easy access and use. Constipation can occur after surgery, and to some degree it's expected given the use of medications such as narcotics as well as the anesthesia itself. Having said that, there are some important steps that can be useful to prevent constipation. The first is drinking lots of fluids. This can be useful to help to prevent binding that can then lead to constipation. The second is that we often will prescribe a medication to help with stool softening and another medication that'll help with constipation itself. It's useful to take these medications after surgery as that can help to avoid constipation issues after surgery. Constipation issues after surgery is more than just uncomfortable. It can actually increase the risk of infection after surgery. So if there's any constipation after surgery, please notify your physician as there may be more needed to help to prevent. Generally speaking, there are restrictions in terms of lifting, bathing after surgery. Please follow the postoperative surgical restrictions that are delineated in the postoperative surgical instructions that are given to you after surgery. It's important not to lift more than 25 pounds for 2 weeks after surgery. Showering is okay after surgery, but submerging the incision in a bath is less than ideal because that can increase the risk of infection at the surgical site. Generally speaking, we don't want patients to be bending or lifting as much as possible for the first 2 weeks after surgery. After that time, depending on the first postoperative visit, there may be some of these restrictions that are lifted and allow for these movements to occur. We usually state to be off of work for approximately 2 weeks after surgery. Now, having said that, there are some forms of work that are at a desk or at home, and in those cases, it is possible to return to surgery sooner. Generally, for those patients, they can return to work after about 2 to 3 days after surgery. Generally speaking, we do not want patients to drive after surgery, especially if they are taking narcotic medications. If you are on postoperative pain medications that are narcotics, we do not advise you to drive, and in fact, we will explicitly prohibit you from driving. If you are not taking pain medications, then you may drive 2 weeks after surgery. Typical recovery period is 2 weeks after surgery until you're back to most types of work. In some extreme forms of work where there's a lot of physical exertion, we'll say 4 weeks. Typically, 4 to 6 weeks is when most patients are able to inflate and deflate the prosthesis, and typically about 6 to 8 weeks is when they're about ready to use the prosthesis. However, this can vary significantly if there's a significant amount of swelling, bleeding, or infection after surgery. The most worrisome complication after surgery is the chance of infection. Signs of infection include purulence or pus or fluid or any kind of discharge at the actual incision site itself. Sometimes there can be what's known as fluctuance. What that is a squishy feeling in the scrotum or in the surgical area that may be pus that is accumulating. This is especially true if this area is tender when palpating. If this were to happen, you need to notify your surgeon immediately. You can expect a good amount of swelling to occur for approximately 1 to 2 weeks after surgery. The area will be bruised. It'll be black and blue for approximately 1 to 2 weeks after surgery, and depending on the patient, sometimes more. It can be swollen at least for 1 to 2 weeks after surgery. Oftentimes 3 to 4 weeks after surgery is reasonable to expect a good amount of swelling. Usually it's about 4 to 6 weeks when the swelling starts going down. If there is what's known as an expanding hematoma, in other words, if the scrotum starts swelling and doesn't stop swelling, it keeps growing and growing, then that is also something that you need to notify your physician with immediately, because that could be a sign of a bleed that needs to be drained. Likewise, if you start noticing a lot of bruising along the belly or noticing difficulty with fever after surgery, please notify the physician immediately. Generally speaking, the postoperative appointments after surgery will be made before surgery. These happen in 2-week intervals. So after surgery, the day afterwards, we usually see you to take down the dressings and put a new dressing on that you will then have additional instructions to take care of for 2 weeks. After 2 weeks, we'll see you again and make sure that you're healing appropriately. We usually see you 2 weeks after that to see if you're ready to inflate and deflate the prosthesis. And then we see you 2 weeks after that to see if you're ready to actually use the prosthesis. Generally speaking, for the first 3 appointments afterwards, we see you every 2 weeks. At that point, some people need more time, some people will need more instruction. And that's okay. We will take as much time as we need to make sure that you're able to properly inflate and deflate the prosthesis afterwards. We usually will see you 3 months at least after surgery to make sure that this is a durable response and that you're happy with your prosthesis. Usually, most people are able to start practicing with the prosthesis about 4 to 6 weeks after surgery. Some people, this takes a little bit longer, and in those cases, we wait until it's the appropriate time to actually use the device. Most people are able to use the device for intercourse about 6 to 8 weeks after surgery. If there are any questions during the recovery phase, please contact the office. We will get back to you and address your concerns.